Hello and welcome everyone to this presentation of Neighborhood Connections. Before we delve into talking about what Neighborhood Connections Toolkit is about, I think it's best to go over the demographics of the city of Azusa first, since this city is the primary example for the toolkit since the program is situated in the city of Azusa. So first off, according to the Southern California Association statistical summary, and this is from 2016, Azusa has a total of almost 50,000 residents. And in the last 16 years, the city's population's growth rate has been 10.7, and it is higher than that of LA County's rate, which is 7.6. Azusa residents are of Hispanic descent, and they make up about 69.7% of the 50,000 residents. The median household income is 58,000, but only with a home ownership rate of 56.9%. And between 2000 and 2016, so about 16-year difference, the median home sales price of existing homes increased by almost 200%, and the sale prices increased by 53.8%. In the city of Azusa, Hispanic makes up about 63.3% of all population, and that also supports why there is that huge need for a community resource specialist or a social worker working in the library to speak both English and Spanish at the same time, or just having a bilingual community resource specialist so that they will be able to better serve their patrons and their program participants. Furthermore, just going a little bit more into details as far as what the city of Azusa looks like according to the U.S. Census that was conducted in 2010. It says that 1 in 5 Azusa residents lives in or live below poverty line. 1 in 4 does not have health insurance, and only 20% actually have a 4-year college degree. And this city ranks 187 out of 265 areas in Social Science Council, and they have below average educational attainment and median income. So a community resource specialist is very important in that they will be able to identify what the program participant needs or what they're asking for or what they're trying to achieve through that consultation, whether it's looking for affordable health care or applying for college or even researching what kind of college they would like to attend. And at the same time, maybe looking at other resources that are available for them and within their community. So the inception of the program Neighborhood Connections, and for why we are creating this toolkit, emulating this program, is because a need has been identified. A social problem has been established, and the community of Azusa decided that creating a program such as Neighborhood Connections is one way of addressing this need, of wanting to increase their community knowledge on available resources and services. And I think the video on this slide really depicts how this kind of program is very beneficial. Yes, it is a very simple program, but it's also very effective. So now we get to the heart of what this toolkit is really about, which is about neighborhood connections. So neighborhood connections, or NC, is an information and referral type of program, meaning that this program specifically doesn't provide case management. It is a type of program where social work meets library services, meaning there is a social worker who works in the library and who is supported by the library staff. And this social worker slash community resource specialist provides one-on-one consultation on matters such as homelessness, low-income housing, unemployment, healthcare, special education, so on and so forth. Again, this is ran by a community resource specialist slash social worker who provides follow-ups as well. Now, going back to how this is an information and referral type of program, I do want to emphasize the fact that because we don't provide case management, it doesn't mean that we can't do follow-ups. So let's say that somebody comes in looking for low income housing, and on the first time that they come in, we help them out by filling out or helping them out fill out an application. We can suggest a follow up appointment to make sure that, let's say, that application has been submitted or that application was received, so on and so forth. Um, we also do in-reach and outreach opportunities to make sure that the library, as an organization, as an institution, knows that this program is available for their patrons as well as the community. So sometimes we would go out to schools, other times we would just post flyers around Starbucks, around public places, to make sure that the community knows that this program exists and that we are here to help them. And as far as funding, I know that Neighborhood Connections was initially funded by a grant and was later picked up by the city budget. So that also depends on the city and the library. So, for this 1 hour or 30 minutes one on one consultation with the community resource specialist, it looks something like a program participant comes in, um, schedules an appointment for, let's say, Tuesday at 5:30. They're given a small piece of paper and to remind them of that appointment. When they come in, they check in with the information, or the reference desk, and then the community resource specialist or the social worker is called to meet with that program participant. And upon sitting down, the community resource specialist will ask the program participant to provide us with their basic information, and this is in the form of a liability waiver form. Now, this form will depend on the city, or on the library, but for this presentation, um, it's basically just asking for the person's name, address, contact phone number, and a signature and the date. And it lists all of it lists in bullet points what basically to what extent is the library or this program is responsible for, and to what extent they're not. So this liability form will be different from the one, let's say, another library will be making. And when we do sit down with our program participants, we do make sure that we ask them if they need, let's say, clarification on what they're signing. And speaking of signing, I do want to emphasize the fact that this is a voluntary service, and this form is also voluntary, meaning they don't have to sign if they feel like they don't want to, if they don't feel comfortable signing it because they don't understand, and if they don't understand, then that's when we come in and we offer some clarification to the best of our ability. um, Going back to how services will be provided, we ask them to sign the liability form, which is not required but encouraged. We also use the information and referral and resource guide that is provided by the library, and the CRS and the program participant together will determine if a follow-up appointment is needed. And then whatever information that, say, the program participant does end up sharing with the community resource specialist, the community resource specialist will then enter the data into the neighborhood connections database for tracking purposes. When hiring a community resource specialist, slash social worker, these are some of the guidelines that I know the library services manager put together, as kind of a guide, for those who are interested in implementing this program at their own library. So, a community resource specialist, what is it? It's the person who meets with the program participants, and they are the face of this program. They are the ones who sit with the program participants and consult with them and provide the information that these program participants have come in here to look for. They also meet, they plan, they facilitate, and they follow up and reinforce. And also, given the information that was shared with the community resource specialist, this person is also responsible for entering the data. Again, the community resource specialist does not perform case management duties. We don't hold on to applications. We don't hold on to paperwork for them. We don't call them and follow up to make sure that they, let's say, made it to their appointment. Um, there are obviously certain exceptions, and we may ask them to come in, or we may ask them for permission if we can call them to follow up. But for the most part, the CRS or the community resource specialist does not provide case management. Um, the community resource specialist is the key outreach staff member for creating connections with agencies such as nonprofits and private organizations. They, like I said, the community resource specialist is the face, um, for the program. So their effort in reaching out to other community agencies and other social service agencies um, is really important in making this program successful. So now we've come to the follow up procedures, and as mentioned in the other slides, we first and foremost come up with a care plan with the program participant, and this includes information on what the program participant has already tried prior to coming to Neighborhood Connections. We want to know, as a community resource specialist slash social worker, what has been done to make sure that we don't try that again, especially if it wasn't effective or if it wasn't successful in the past. We also, because we're very limited in the time that we have with the program participant, we want to make sure that that time is spent on coming up or brainstorming with ideas that hopefully will provide better outcomes for program participants. Um, we provide assessment in that, do we do we know if this is going to work for them? Do we know if this is a suitable practice for this program participant? And then we then come up with that care plan and evaluate the effectiveness of it by doing the follow-up call, which is something that takes place usually 2 weeks, 3 weeks after the first consultation. And then we also enter data into the database. Like I said, for tracking purposes, we enter information on completed consultations. So we use the liability waiver forms that we ask the program participants to sign, um, just so that we can, if we need to, call them and find out if, let's say, they need a follow up appointment. And another part of following up is also connecting with other providers. We don't just follow up with the program participants, but we also call up and follow up with service providers to make sure that the program participant has successfully reached out to them, and that when it's off our hands, that somebody else will basically take care of them. So Neighborhood Connections has been in place for about 2 years now, and it has been a very successful program, especially in helping out those who really need that assistance and guidance in locating and utilizing generic resources and community services and programs that are available to them within their community. And one way of measuring the success is just keeping track of how many program participants have come in using the database, using the liability waiver forms that you ask them to sign every time they come in. We also look at positive outcomes. How many of them have actually followed through? How many of those people coming in for employment to actually get a job? And like I said, this is done through the follow up. We also measure success through the improvement of program participants' ability to be on their own. One of the things that we want to do as a community resource specialist slash social worker is to make sure that we empower our program participants. We want to send them off a feeling that they've accomplished something by coming in, but also at the same time that they have the capacity and the ability to do or seek the information that they are looking for through different avenues, such as the internet, the library, the information desk, so on and so forth. We also measure success by keeping track of how many new partnerships we've had or we've established, and going to partnerships. I know that Neighborhood Connections, with their current resource specialist, they have made tremendous effort in really reaching out to other community agencies, such as the Master of Social Work program at APU, Azusa Pacific University, and having their intern actually create the resource guide for this program. Um, Partnering up with the Halo Azusa Police Department, the city of Azusa itself, and also other service providers in the community. This is the end of our presentation. I hope you all enjoyed it, but most importantly, I hope that this presentation answered some of the questions that you have with regards to starting your own program, Neighborhood Connections at your own library. Again, thank you so much for coming to check this out and have a wonderful day.